Boys, if you could be taller, just magically, would you take that?
No, I don't need to be. I'm 6'4", so I'm fine. Jim, you're just over 6, so we're pretty fine.
Look, I realised when I was younger that when I got to a certain height, and I'm under 6 foot, about 5'10" on a good day.
With your lifts
in a strong wind. I was like, I'm not the most attractive. I'm not the tallest, but I'm going to be really funny.
Yeah.
Because personality goes a long way.
That's your
And
draw
look
card.
at me. Look at me. I get paid for personality.
Yeah,
So funny.
you do. Yeah, it's the beauty of radio, isn't it?
That's my giant penis.
Well, there's lots of short kings around that wish that they could be just a little bit taller. And, Materialist, that new movie that's come out, you've seen it, Jimmy. Pedro Pascal's character is rich, hot and tall, but he's not like real tall. He's fake tall because he got leg lengthening surgery, which is a real thing that people pay up to $250,000 for.
I've heard of people doing this.
We've tracked down an orthopaedic surgeon. We've got her on the line now, Dr. Sheanna Maine. Hello, Dr. Maine.
Hi, Dr. Maine. Welcome.
Hey guys, how are you doing? Hope you're having a good morning.
No, we are. Thank you. Dr. Maine, this is fascinating to me. So have you performed this surgery before? Have you made people taller, essentially?
So essentially, yes. We do limb lengthening surgery, we call it, for a variety of conditions. And the majority of these conditions are for medical reasons. So where a person has a short leg because of trauma or because of an infection or a congenital deformity. But there are very few patients who do wish to be taller, and in very rare circumstances, we can perform these surgeries to improve height.
Okay, so how does it work? Like, what are you putting in there to make the leg longer?
Is it the femur? Is it the tibia, fibia? Sorry to use technical terms.
Sorry, Dr. Smith.
Oh, don't say fibia, not the fibia.
So where do you do it? How does it work?
Yeah, so it depends firstly on which bone is considered short. So you have to examine your patient and have an idea about what's going on. But for lengthening procedures, it can be performed in either bone. Or sometimes both bones, as the case may be. Ooh. And there are, issues in lengthening, bones, as you know. So the way we do it is we cut the bone, and then you need to have a device either on the inside or the outside of the bone that very gradually draws that break apart. Oh. And so we usually lengthen the bone at about 1 millimetre a day, whether it's via an external construct, which we call a frame, or whether it's via a little nail that goes down inside the bone.
Wow! I've had so many surgeries, like not because I want to have them, because my body's shit. Yeah, so, shoulder recos, knees, and that. Like, it's just the worst. The rehab is the worst, right? And I got to go in. I got to get my shoulder cleaned up again. It's keyhole surgery. But why would, in your opinion, people do this just to be taller? Like, it's surely it's painful. Like, how long's the recovery process?
Well, that's the thing, isn't it? And it's a really sort of an ethical question because the reason that someone wants to be taller is primarily psychological, we have to admit. It's a insecurity with our own body, and we face so much of this in society today. Yeah. So, as a surgeon where you're putting somebody through an extremely traumatic, difficult procedure, I think the first thing is that they need to have a really good understanding about what they're getting into, because it isn't plain sailing. There are a lot of risks. And you don't want to be doing this for somebody who just wants to be taller without an understanding of what they're really getting themselves into.
So what is the recovery time? From surgery to, all right, I can go out and walk around now. How long does that take?
Yeah, so it depends on the length you're trying to get, right? So
how much taller do guys want to be on average?
Usually the ones that have come to see me are wanting at least 10 centimetres.
10 centimetres?
At least?
Yes. At least 10. And so that's a big, big risk.
How short are they? Like, what are they going from in height-wise? What does the 10 centimetres get them?
You know what? I'm 5'4", and they're all taller than I am. So in my eyes, they're all tall, right?
That's like me. I'm 5'2". Everyone's tall.
So, Dr. Maine, so I come in and I want an extra 10 centimetres, right? What is from me coming into your surgery, getting the surgery? When am I now 10 centimetres taller and I'm fine to walk around?
Outside,
what's the time?
You are going to be out of action for at least a year.
A year? Wow. So are we talking on crutches, in a wheelchair? Like, how long? What's the situation?
I'm assuming you want both legs lengthened. Is that correct?
Yeah.
Well, it depends.
I can only afford one at the moment.
Depends on my financial. I'm a big hopper.
Stilts for the other leg.
Right.
Come here, my darling.
A peg on the right,
So-
just for now.
And I'll have a parrot on my shoulder.
Yeah. Do you do claws? Do you do hook hands?
I'll get you, Peter Pan.
So
That's
are we talking?
exactly right.
Are we talking crutches, Dr. Maine?
So you will need to be on crutches for, the period of time where the bone is lengthening, and then a small portion of the time where the bone is what we call consolidating. So the first part of the procedure is to cut the bone and wait for it to start to heal.
Yeah.
And then as you drag the bone apart from each other, the body wants to heal. That's what bone does. It loves to heal. So you lengthen the bone slowly. But the problem is not actually the bone. The problem is that as you lengthen a bone, all the nerves and the muscles and the tendons have to stretch.
Of course.
So this is primarily a procedure where the complications are defined by the soft tissues, by the muscles and the nerves.
Yeah.
And so it's really common to end up with contractures in your joints where your knee won't straighten or your ankle won't move properly.
So there's all these risks involved too.
But also, like, what do you tell people at
That is
work
where-
when you're on crutches? It's
that
like,
is
I
where-
had a footy injury. Like, you're not
Yeah.
going to admit that you got leg lengthening
right, so-
surgery.
But also, you're going to start like, even if you took a year off, right, you disappeared into the wilderness, you go, I'm doing a world trip, whatever, you'll come back 10 centimetres taller.
Yeah, right.
Like, it's quite obvious.
Yeah. Well, I was in the Northern Hemisphere. That gravity pulls you up. So Dr. Mate, let's talk cost.
Yeah, what
right?
does it
Do you
cost?
charge per centimetre or like per ruler length, or what? Well, if I want a 10-centimetre lift, how much does that set me back both legs?
Yeah, so this is not a Medicare-funded procedure. So patients have
Shock
to pay
me.
for the prosthesis, which we use to lengthen them by, and that can be in excess of $10,000. Then there's the hospital stay, there's the nursing staff, all of the allied health support that you need around it. So
What
you're
about all
not
the,
going to come away.
like the physio and the rehab?
Yeah,
Like
and
that, if you're
OT.
saying
The
12 months,
physio
like,
is critical,
Yeah.
and it's really important to have a good team around you, both yourself as a patient and
Yeah.
as a surgeon. For me, you need people who understand the procedure and who are capable of delivering that support and care. So you're not going to get away from the lengthening, I would say, under $50,000 if you're funding it all yourself.
Yeah.
50 grand.
Plus a year of your life.
You want to impress the ladies,
Exactly.
buy a 50 grand bag for her. You know what I mean?
Exactly.
Yeah.
That would be my suggestion. There are a lot of nice bags out there.
That's
that you would go for.
right. And women love bags maybe even more than they love tall men.
100%. Dr. Maine, thank you very much. We appreciate you coming on the show. Orthopaedic surgeon. Jim will come in for his surgery in a couple of days. So we'll see you then, okay?
yeah, I just need a reduction. We'll say where afterwards.
yeah, he's 8 foot. Thank you.
There are some bones we don't operate on, Pete. All right.
Thank you, Dr. Maine.
Pleasure. See ya.